Cool. All right, so I've verified my doctor's orders. I've gathered all my supplies, and I've made sure that all the packaging is intact and all the expiration dates are available. Go ahead and enter the room.
Come in.
Hello, hello. How's it going? My name's Luke. I'm gonna be your nurse today.
Okay.
Can you verify your name and date of birth for me real quick?
Ivy Armstrong, 3969.
Perfect. Check this out. Do you mind if I set this on the bed real quick?
That's fine.
Okay, perfect. And do a little hand hygiene real quick. How you doing this morning? You sleep all right last night?
I barely slept.
No, I'm sorry to hear that.
Yeah, it's been like that for months.
Yikes. Well, hopefully we can get you a little step better today, all right?
Okay.
I'm gonna throw some gloves on real quick. Hand me that glove box. Perfect, thank you. Before I get to work, do you mind if I turn these lights on real quick?
Alrighty.
Alright, go ahead and wipe down the workstation. And we'll get to work. Whoa, 28, 29, 30. Let's dry. I'll go ahead and move my stuff up and switch my gloves out because I don't want them dirty. Alright, next thing I'm going to do before we get going, I'm going to raise you up a little bit. Get you to work in height. And before I start doing anything, I'm going to give us a little bit of pressure. Okay. Go ahead and open up my glucometer. Turn this bad boy on. Pull these things out. Oh boy. All right. Let me go ahead and scan my ID. And then scan the patient. There we go. Thank you, Ivy. And do you mind just verifying your name and date of birth, please?
Ivy Armstrong, 3964.
Perfect. All good. Now I'm going to scan my strips. That's just going to tell me what your blood glucose is. I'm going to put one of these in. Perfect. All right. So I'm going to have to stick you in order to test your blood glucose.
Okay.
Do you have a preferred finger that you'd like me to do, or a preferred hand?
Any finger on my right hand.
Perfect. All right. Go ahead. Swab you down. 28, 29, 30. All right. You are all clean. Go ahead and loosen this finger prick real quick. All right. I'm going to go ahead and give you a quick prick real quick. 3, 2, 1. Perfect. Now I'm going to wipe away that first drop. Second one. And now I'm going to dab at this. All right, it's looking like your blood glucose is a little high, so I'm going to go check in with the doctor and check his orders, see what he wants to do about that, and I'll be back in just a little bit.
Okay.
I'm cleaning up my workstation. Lower you back down. Okay. Do you want me to leave the lights on? Turn them off?
Oh, you can leave them on.
Perfect. All right. So I'll leave those on. Stuff. And I'm gonna go check in with the doctor and see what he wants to do, and I will be right back. Your call light is in your left hand. Just call that, press that if you need anything, and I'll come running right back, all right?
Alrighty, sounds good.
Cool. Back in a sec. Okay. I'm now turn sweet. Perfect. I actually need to get behind you real quick, but now I'm in the med room. I'm gonna prepare my medications. We have actually I'm gonna get my hand sanitized real quick, put some gloves on. Real up close and personal with these camera angles. I love it. Okay. Making sure my hands and my workstation are clean. Okay. Just gonna see if this can raise up even more. Perfect. All right. So doctor's orders are in. I have gathered my medications. Expiration dates are fine. I'm going to be administering 5 units of NPH and 5 units of regular insulin. First thing I'm going to do is prepare to sanitize the tops of the vials. Put that on. Put that on. NPH. Okay. 28, 29, 30 seconds. That one. 28, 29, 30. Done. Uncapping my needle. I'm going to draw up 5 units worth of air. I'm going to insert that into the NPH. Pushing in, coming out. And I'm going to draw up another 5 units of air. Insert that into the regular insulin. Now I'll flip it over. Turn that with me, but I'm going to draw up 5 units of regular insulin. What does that say?
That says 5.
Perfect. Pull it out, down, and I'm going to insert into NPH. Draw out 5 units of the NPH. What does that say?
10 total.
Perfect. That's what I'm looking for. I'm going to go ahead and recap using the scoop method. I'm going to label this as 10 units total of insulin, 5 of NPH, and 5 units of the regular insulin mixed together. Label that, clean up my workstation, and then head back to my patient's room. That. Perfect. Okay, I'm now gonna re-enter my patient's room. So again, I verified my doctor's orders. I have the medication with me, the 5 units of regular insulin and 5 units of NPH. I've got my supplies, nothing's expired, everything's good to go. I'm gonna re-enter.
Come in.
Hello, I'm back again.
Hi.
Luke, if you didn't remember, can you, real quick before we get started, verify your name and date of birth?
Ivy Armstrong, 3964.
Perfect. I'm gonna go ahead and rub my hands, sanitize real quick, put some gloves on. and chatted with the doctor, and he thinks that the best course of action is going to be to give you a little insulin to bring that blood glucose down a little bit. Do you mind if I set these things on your bed real quick while I write down my table?
That's fine.
Perfect. Okay. Perfect. All right. I'm letting that dry actually. I'm gonna turn these lights back on real quick so I can see what I'm doing. I'm gonna raise you up a little bit. Perfect. I'm gonna put this up on the work table. Give us a little bit of privacy. And I'm going to pull up our medication for today. Come on now. This technology isn't working with me. There we go. Okay. All right, before we get into administering your insulin, do you mind doing me a favor and just reaffirming your name and date of birth?
Ivy Armstrong, 3964.
Perfect. Matches your wristband, matches my chart. So we are good to go. We're going to fold you up. There we go. Going to scan in your barcode. Perfect. And scan the regular insulin. Perfect. I'm giving you 5 units of regular insulin. We're going to do that subcutaneously, and we're going to do that right now. I just want to make sure that I've documented it so that everyone knows exactly what you're getting and when you're getting it. Okay. Administer, and now I'm going to go through the NPH. So, H. Come on now. There we go. And one more time, name and date of birth, please.
Ivy Armstrong, 3964.
Perfect. Sounds good. And we're good to go. Okay. So, I want to change my gloves real quick because I was just using the computer. I want to make sure I'm nice and clean for you. Hit hand sanitizer. And switch out the gloves. Alright, so this is a subcutaneous injection. Typically we'll either do this in the back of the arm or in the abdomen. Do you have a preference on where we go today?
My abdomen, preferably.
Perfect. Nice and easy. We're going to make sure that we have some privacy. I'm going to go ahead and expose your abdomen. Find your belly button. 2 inches on the left. I'm going to sanitize real quick with a wipe. 28, 29, 30. All clean, good to go. Okay. So one more time before I give this to you. You're getting 5 units of regular insulin and 5 units of NPH. This is to lower your blood glucose. I'm giving it to you right now. I've got it documented. And just one last time, your name and date of birth.
Ivy Armstrong, 3964.
Perfect. All right. I'll go ahead and pinch this real quick. Gonna put it in, release, inject, and pull out. And then I'm gonna scoop and cap. This will go in the sharps. Put this cotton ball on and apply some pressure. Make sure we don't get any bleeding. Shouldn't be that big of an issue. Pull that away. Whoop, sorry. I'm gonna cover you back up. And dispose of everything. This on my shorts. All right, I'm gonna lower you back down. Is everything feeling all right?
Yeah, I feel pretty good.
All right, solid. Well, we got you some insulin. And I'm gonna come back in like maybe 20 or 30 minutes, just check on you, see how you're doing. Just don't need to pause, but I forgot to ask about allergies. So just real quick, I'm gonna ask, Ms. Armstrong, do you happen to have any allergies that I need to be aware of?
Only latex.
Okay, thank you. It wouldn't have affected any of my procedures, but I just wanted to make sure that I had that. I'll be back in 20 to 30 minutes to check up on you and see how you're doing. Do you have any questions right now?
No, can you just turn the lights back off? Kind of getting a headache a little bit.
Perfect. Absolutely.
Thanks, that feels so much better.
Right. I'm gonna log on my computer. Actually, I am gonna log on my computer. Okay. Make sure the station's clear. Remove that. Make sure that you're locked in. Good. All right. If you need anything, your call button is in your left hand. Just press it and I'll come running. Anything else before I go?
No, that's it.
Perfect. All right. Thanks so much. I'll be back in a bit to check on you.
Thank you.